3 years ago, Gail Copeland's life was turned upside down. Her breast cancer diagnosis came after a routine health check. The fact she had the disease came as a shock.
When I got out of the hospital, I just burst into floods of tears because it then dawned on me that actually I had cancer, I had breast cancer. Am I going to die of it? Am I going to be okay with this? Am I going to have to lose a breast? Am I going to see my grandchild grow up?
After 20 rounds of chemotherapy put her cancer on the back foot, doctors said she no longer had any signs of the disease. But if Gail hadn't been for that checkup in February 2017, she fears she might not be alive today.
The checkup for me was absolutely crucial. It was 100% that's what picked up my cancer. Had I not gone for that, then I don't actually know what the outcome would have been. I don't know if I'd be sitting here talking to you today because, as I said, there was nothing to see, there was nothing to feel, and it was through the screening completely because the tumour was deep in my breast.
Gail sees herself as one of the lucky ones because she came through it and didn't have cancer during a global pandemic. But she's concerned for those that do and fears delays to treatment and diagnosis because of COVID could be fatal. Analysis of Scottish cancer waiting times by the charity Macmillan suggests there's more than 2,000 people in Scotland who should have started treatment for cancer between April and September who didn't. Perhaps more worrying is that they estimate as many as 4,300 people in Scotland are living with an undiagnosed cancer. That's despite an increase in capacity in the cancer care system. Macmillan says tackling the backlog of patients caused by cancelled operations could take up to 18 months.
So what happened in the first wave is that a lot of treatment was disrupted, inevitably perhaps because it was a completely new situation. But the NHS and the government and charities like Macmillan, we've learned a lot from the first time around. We want to see cancer services ring-fenced and protected so that backlog, which is already worrying, doesn't grow. And then we also want to see the Scottish Government continue to take urgent action to reduce that backlog. If you are worried about any symptoms, any medical concerns, please do go and see your GP because we don't want to see an increase in the drop in diagnoses.
People are worried that they should have had treatment during that time and they know that they've got cancer, and is that cancer growing? Is that cancer developing in that time? That's a big worry.
The Scottish Government will soon publish a post-COVID recovery plan, and Macmillan hope cancer treatment will be protected. It is because Gail's cancer was caught early that she can share this message, but she knows firsthand how it can affect life and what the ultimate price can be. Lewis Warner, ITV News, Dumfries.